Now, remember this, some of you already know this. Dr. Laura had a patient who had a particular eye issue, was going blind, used the PEMF,
Wet macular degeneration.
wet macular degeneration, which was the worst. And her retinologist said a couple months ago, I guess it was now, after using this for 2 months, she was told that the retinologist says, I can't find any fluid in either eye anywhere.
Richard, she used that device first.
Yeah.
And she
Yeah, she
got it
used this.
reversed from wet to dry. And then it just didn't get any better than that. So then we gave her the pad,
Oh.
or that cheap pulse machine, which is just like the pad, and her vision is now normal.
And what did she
Wow.
do, sleep on it? Or how did she?
She'll show you. She'll just place it on her eyes.
So see, there's also energy coming out of your device. So if you're in a pinch and you don't have a pad yet, there's not as much, it's a really small field, but if you're dealing with something like the eye. But in this case, this is the cheap pulse. The tape doesn't come with tape, it's ours. That way we know it's ours. The last 2 months she did this, and that's when she got the final bill of health, the clean bill of health on the eyes. And what she told me was that, she said, well, Richard, are there any side effects? You know, I've been aiming this thing in my eye, both eyes, and are there any side effects? Because I know that it's got to be doing something in my brain. I said, well, yes, sure, what are you asking about? And she says, well, for a long time now, she's 79 years old, for a long time now, I would be talking with a friend. I'd come to a point in the conversation where I wanted to use a particular word to describe something and I couldn't think of it. And to quote her, she'd say, I use 10,000 other words to explain that one word. And then she says, but not anymore. I said, well, that's one of the side effects, yeah.
What was the protocol on this? Like how many minutes a day?
She was doing 15 minutes an eye twice a day. In blue stem, but in her device, that's all she had. I would use RSI, it's a little stronger.
With the wand device.
Well, she had this the last 2 months. She was using this before that, and it made a difference. But as she aged, we weren't treating the cause of the degeneration. We were just treating the symptom, which in this case, sometimes you have to do what you have to do. And when she got this, though, that's what took it the rest of the way. And the field on this is actually a little bit bigger than the field on this, and this is great. This is like candy.